It may be that you have to do CPR, but you're not able or not willing to do the breaths. Now, this is one of the fears of first aid we've discussed earlier. It may well be that their face is covered in vomit or blood, or maybe they've got an injury to the face and you can't physically put your face down there, or you just don't want to, you don't feel comfortable doing the rescue breath part of the CPR cycle. This is not a problem because we can do continual chest compressions. It's exactly the same as we've already learnt, but this time we are just doing compressions, we're not doing any breaths. So the other advantage of this is that it's simpler and it's easier to do. So you can also do this if someone you handed over to a second rescuer and that person was not comfortable doing CPR, full CPR, but you are. So then we can mix and match that way as well. As far as doing continual chest compressions, there is already oxygen-rich blood in the body when you arrive. So there's a starting point. But also, as you push down on the chest, you will force air out of the lungs. And when you let go, air will come back into the lungs. It's very crude, but there is an element of air flushing in and out of the lungs. The other advantage of that air is it's 21% oxygen instead of the exhaled air that you would blow out, which is only 16%, because your body uses about 5%. So the process is exactly the same as normal CPR. We're stopping, thinking and acting. We're doing a little risk assessment, make sure there's no dangers that we're going to come across. We're approaching. We're going to still introduce ourselves. Hello, my name's Keith, I'm a first aider. May I help you? Are you okay? Tapping the collarbone. We're going to open the airway up. So we fully open the airway. We're going to do a breathing check for 10 seconds. Put your ear down. Look down the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We're still at this point going to have to activate the emergency services, either on your phone, put it in speakerphone, or ask somebody else. You know, can you go and dial 999, ask for an ambulance, tell them we're at Westside Centre, Colchester, and we've got a non-breathing adult and we're doing CPR, and come back and tell me what they say. But while you're doing that talking, you can start with the compressions. And all we're doing is exactly the same position, hands across into the breastbone, pushing down, and we're just carrying on doing those compressions, and we're doing them exactly the same speed, 100 to 120 compressions per minute at a depth of 5 to 6 centimetres. So the compression side is the same, but you just don't do the breath side. Only thing with it, if you want to, you can count out loud, or you don't have to. You know, if you're happy with the pace that you're going through, that's absolutely fine. If not, you might want to count to 30 and back to 0, or you might just count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and back. Whatever you find easier, just to keep that pace going. And you just keep going on that until the AED arrives, or until the EMS arrive, or you hand over to a second rescuer.